Now, from the youngest country in the African continent, we bring you back home and specifically to Uhuru Park, where our reporter Caroline Kamau has been on ground just monitoring what is happening with the health workers' strike. Good afternoon, Carol.
A very good afternoon to you. Thank you so much for joining us. My name is Caroline Kamau. Regina, as you rightfully said, I'm at Uhuru Park, and for the second day this week, health workers are out here in the streets, still trying to push the government for promotions and redesignation on a strike. That is health workers under the Ministry of Health. They started a strike on the 29th of last month. Have they made any headway through their negotiations with the ministry? I will invite George Kibore to the set. He is the Secretary General, Kenya Union of Clinical Officers. Judge Kibore, thank you so much for your time.
Thank you, Caroline, for having me.
All right. So you started a strike on the 29th of this month.
Yes.
Services have been paralyzed in most public hospitals. Have you made any headway so far? How is it looking like at the negotiation table?
Caroline, thank you for that question. I need to be very specific that indeed, as we are talking, the health workers, all the healthcare cadres which are under the Ministry of Health are on strike. And the facilities that have been affected are Madare Hospital, Spinal Hospital, Spinal Injury Hospital. We have all the the JKIA, all the ports of entry. All those have been affected. Unfortunately, since 2019, we have had one meeting with the ministry, and they promised that as per yesterday, they were to be able either to communicate that they are ready to issue the letters of promotion. But up to date, as we are talking here today, nothing has forthcome yet, and we haven't heard from them. We will be dispatching our leaders at Trace to try and reach out to them, because it's not our celebration to be on strike. It is unfortunate. The issues of promotion and the redesignation has been there all along, including we have had several agreements with them that this is how they need to implement the promotion and the redesignation for the healthcare workers, but they have not. And you must get to understand that the issues of promotion affect healthcare workers in different ways. That's to mean if you were not promoted as it's supposed to be, during when you are actually retiring, it will be affecting your pension scheme. That's to mean you will retire lower job groups than how you are supposed to be. And there is clear policies, including the Public Service Commission HR manual, that provide on how people are supposed to be promoted. For those which are under the common cadres, and the date of effect, the effective date of promotion, and for those which are above those job groups. And therefore, if this one doesn't happen, our healthcare workers are so much demotivated and are not willing to continue working because the promises have not been forthcoming all through.
The talk has been about, of course, the strike has been pushed by the issue of promotions, and I think Kenyans are wondering, why should we care as Kenyans? Why is it important for these health workers to be promoted, to be redesignated? Why should we care as Kenyans?
Yeah, as I've said, the issues of promotion affect the social welfare of all employees. For those who knows that once you have been employed, there is an entry job group, then there is common cadres where the effective date is after you qualify. That's to mean, like currently since 2016, the first entry job group is 1 year. So that's to mean you'll be promoted to the next job group. Then the next job group again you are promoted. But unfortunately, it's not happening. And once it is delayed, what normally happen under the normal practice of the policies that have been provided is that they need to backdate. Now the ministry is not willing to backdate, because now they know that that's to mean that they will have to pay if there is any increment that was supposed to have happened on your promotion. Now the issues of redesignation. Majority of these healthcare workers were employed as the general practitioner. Now they have specialized. And once they have specialized, that's to mean they have attained more qualification, that they offer different job group, which is specialized. So that one need to be provided under their file, so that even if someone is taken to medical legal issues, you are not to be presumed to be masquerading. So they must be able to be taken to that, so that it is in tandem with what you have trained in, with what you specialize and what you practice, so that it is in file. And that's to mean that now you are taken in a higher job group, and which is agrees and provide for your job description. Yes.
There has been incessant strikes since, well, devolution came on board. And you've been pushing, of course, for the Health Commission. Just talk a little about that as we bring this to a close because of time, why this is important and why you want it included in the BBI report.
That is very important because now you can see the current wave of the BBI, and we have said since the devolution in 2013, it should be remembered that before devolution, the healthcare workers went on strike, and they were calling to have a commission that can look into the human resource issues for all the healthcare workers. Now, because they did not have that chance, and again we have the BBI issue, we are asking that the ministry, the state under this country must provide for the healthcare workers to have a health service commission where all our issues for health workers must be considered and be looked at wholesomely, rather than the way it has been discriminative and other counties considering promotion and others do not. And that's why we are saying that this will bring to an end these issues of strike.
Kibore, thank you so much for your time. I will cut you short, but this is a conversation that will certainly continue.
Thank you very much, Caroline, for having me on Channel 1.
All right, thank you so much. That was George Kibore, the Secretary General for Kenya Union of Clinical Officers. Back to you, Regina. A raft of issues that they've raised there, and of course we'll be highlighting this in our subsequent bulletins. Back to you in studio.
Thank you very much, Caroline, for that update. Day 2 of the strike by health workers.